Today we're going to put on our detective hats and solve a classic medical mystery. The kind that can send a chill down the spine of pretty much any parent. So let's get right into it.
So, picture this. A child has a fever, and then a red, blotchy rash starts to appear. What's the very first thing that pops into your head? For most of us, that one word is measles, right? It's the classic culprit, the one we've all been told to watch out for.
So, in our little detective story here, measles is absolutely the prime suspect. It's the one that jumps right to the top of the list, and for some pretty good reasons. Let's build a clear profile of this well-known offender. So, what is measles exactly? Well, its official name is the rubeola virus, and it is incredibly contagious. Seriously, it just hangs in the air after an infected person coughs or sneezes. This is our baseline, the standard against which we're going to measure all the other suspects.
Every good detective looks for clues, right? The calling cards left behind. For measles, there's a very specific pattern. First, a high fever. Then come the classic 3 C's. A nasty cough, a runny nose, that's coryza, and red, gunky eyes, or conjunctivitis. But the real smoking gun, these tiny little white spots that show up inside the mouth. Those are called Koplik spots. And only after all that does the famous rash appear, starting up on the face and just marching its way down the whole body.
Okay. But here's where our case gets really tricky. A fever and a red rash? That's not unique to measles. Not at all. There's a whole lineup of lookalikes, other illnesses that can look so similar it can cause a ton of confusion. So let's bring in the other suspects.
First up, we've got the most famous sound-alike, German measles, also known as rubella. Now, the rash also starts on the face and spreads down, but it's usually lighter and goes away faster. The biggest tell, though, is that rubella's other symptoms are way milder, and it has this one unique clue that measles doesn't: swollen lymph nodes right behind the ears.
Next in the lineup is roseola, and this one is all about timing. See, with measles, the fever and the rash are basically partners in crime. They happen together. But with roseola, a really high fever will burn for a few days, and then it just vanishes. And only then does the rash show up. It's a totally different sequence of events. Oh, and the rash starts on the torso, not the face.
Suspect number 3 is fifth disease, and honestly, its rash is a dead giveaway. You don't get a full-face rash. Instead, you get this super bright red rash on the cheeks. I mean, it literally looks like the child was just slapped. Then this lacy, almost net-like rash appears on the body. It looks totally different, and it doesn't come with the calf or red eyes you see with measles.
And of course, we have chickenpox. The huge difference here is the texture of the rash. A measles rash is flat, it's blotchy, but a chickenpox rash, that's made of itchy, fluid-filled blisters. Plus, they show up in waves, so you'll see new blisters, old ones, and scabs all at the same time on the body.
So we've been laser-focused on all these rashes, but what if we're looking at the wrong thing? In a real investigation, focusing on one misleading clue can send you completely down the wrong path. What if the most critical clue in our mystery isn't even the rash? This brings us to a plot twist. We're going to pivot our whole investigation to a totally different and, frankly, more urgent clue. It's a distress signal that has nothing to do with the skin and everything to do with breathing.
I'd like you to meet our surprise culprit, respiratory syncytial virus, or RSV. Now, RSV isn't really famous for a rash, although sometimes it can cause one. Its real claim to fame is its attack on the lungs. It causes this inflammation of the tiniest airways, especially in infants, which is a condition called bronchiolitis. And this is super dangerous for little kids because their airways are already so small.
With RSV, the clues you're looking for sound and look totally different. You're listening for wheezing, you're watching for really fast breathing, you're looking for their nostrils flaring out when they breathe in, or for the skin sucking in between their ribs. That's what we call intercostal retractions. These are all signs that they're working way too hard to breathe, and they're urgent signals that a detective who's only focused on a rash might completely miss.
And why is this so important? Because RSV isn't some rare, obscure virus. We're talking about the single #1 cause of these serious lung infections in babies under a year old. That makes it a hugely important suspect to consider, especially in the youngest patients.
Which brings us to our conclusion. This whole case of the red rash is so much more complex than it looks on the surface. It's not just picking between a few viruses. A doctor's job is really to be a master detective.
Just look at this table. It shows you the real challenge a doctor is up against. They have to think about culprits from totally different categories. Is it a virus, like measles or RSV? Or maybe it's bacterial, like scarlet fever, which has its own weird sandpaper rash. Could it be an inflammatory issue like Kawasaki disease? Or maybe it's just a reaction to a medication. The list is long. And just when you think the list of suspects is long enough, it gets even longer. As this quote points out, for patients who have weakened immune systems, the world of possible infections gets a whole lot bigger and a whole lot scarier.
That's right, for immunocompromised patients, the diagnostic lineup can actually include rare fungal infections. And you can't treat those with just supportive care or antibiotics. They need powerful antifungal drugs. So getting the culprit wrong in these cases can have really severe consequences.
So after looking at all this evidence, what's the final verdict in our red rash mystery? Well, the truth is, there isn't just one simple answer. The real takeaway here is about the process of detection itself.
So what can you do? The best thing is to be a great partner to the lead detective, your doctor. First, document the whole story. Have you traveled anywhere? Is your child up to date on vaccines? Any new medications? Second, observe all the clues, not just the rash. And third, and this is the most important one, always consult the expert for the final diagnosis.
Just as these physicians say, a real diagnosis is not a guess. It is a methodical process. It takes a detailed history, a careful physical exam, and sometimes specific tests. It's really about putting all the pieces of the puzzle together in the right order.
It's pretty amazing how something that seems so simple, like a red rash, can be so incredibly complex underneath. So, thinking back on our lineup of suspects, from the weird timing of Rosola to the scary breathing of RSV, which one of these medical mimics surprised you the most?